Catholic Healthcare as an organization has a proud tradition of providing care, which began as an initiative of six religious groups that come together to invest all of its revenues in increasing the quality and accessibility of aged care support for all seniors here in Australia. Their organization comprises the statutes of Catholic healthcare, the norms of canon law, and the governance structure as a church entity. Their trustees are chosen by the members and are in charge of owning and managing Catholic healthcare's ministries and property. As the only member of the civil legal organizations that carry out these ministries, the trustees employ their reserved powers to fulfill their mission. Catholic Healthcare Limited, a not-for-profit company, is a civil entity providing healthcare, aged care, retirement living, community, and related services. From a small group, Catholic Healthcare has grown to be one of the largest providers of Catholic aged and community services in Australia. Working in metropolitan, regional, and rural New South Wales and also Southeast Queensland, Catholic Healthcare now owns or operates 42 residential aged care services and 12 retirement living communities, adapting to its current demand for care for the aging population. This organization has created a tagline, "Care Runs Deep," which is defined as being an organization that understands their clients' wants to have their independence at home and them being ready to provide the necessary support. This dove, which serves as the organizational logo, has been recognized as a universal symbol of hope and comfort, connected to its mission statement of promoting life in all its fullness by providing aged, health, and community services inspired by the Catholic tradition, and upholding the intrinsic dignity of all those they serve by focusing on their holistic, person-centered care that fosters living life to the full. All of these are supported by values that are reflected in the behavior of its staff, their model of care, and attitudes such as compassion, respect, honesty, hospitality, and excellence. Their cooperative culture values equality, wherein they can grow their career across the organization. They're committed to providing practical, meaningful learning opportunities from induction through clinical and onto leadership. Catholic healthcare, having cooperative culture, has shown solidarity and philanthropy to the community by having preferential options to help the poor, advocating for the rights of the vulnerable and aged, and the inclusion of the marginalized, which they consider the social justice of the gospel or Christianity and is not any political or ideological driven choice. They have assumptions that through good Samaritan law, the organization may ensure our ethical approach that is consistent with the social justice principles of the Catholic Church. One way of doing this is by providing pastoral and spiritual support care services in response to significant life events, independent of a person's religious beliefs. The staff plays a big part in one of the strengths of their company, which is providing 24-hour care for elderly patients and allowing continuous health monitoring. Safety issues such as falls among older adults can happen to result in clients' dissatisfaction. An unfortunate event like this could cause the client considerable harm. When it comes to potential enhancements or opportunities, Catholic healthcare should actively encourage client independence and staff training. A workable alternative that could assist in addressing increased care costs and efforts. Since this problem directly affects patients' outcomes, the lack of interdisciplinary support and collaboration should also be identified as a shortcoming. Collaborating within a medical team will also help in making sure that a patient's safety is ensured and receives the right care and medication. The COVID-19 pandemic is considered a threat to the Catholic Health Care Organization's external environment. It is a complex social issue that needs to be addressed by everyone in the organization, considering the welfare of their clients as being vulnerable to diseases. Moreover, it depends on the quality of the decision-making process, which is an important prerequisite that increases the likelihood of positive outcomes. Some recommendation that is an important concept in the field of decision-making is the OODA loop by John Boyd, or the Observe, Orient, Decide, Act loop. Through this, Catholic Healthcare's management teams from the top level to bottom management will get a better understanding of the issue before finalizing the decision regarding isolation and quarantine or standard precautions. Second is to reconceptualize the reality, to segregate which is the true problem and create a sense of urgency to come up with a solution, such as to avoid the spread of the virus and thus protect their well-beings. Lastly, understand the 5 whys to assist in finding the cause and complete picture of the actual problem before jumping to solutions. Achievement motivation theory by David McClelland can play a great part in reinforcing the process of decision-making, in resolving the threat within the organization. Focusing on the need for affiliation, caregivers are deeply motivated to achieve the best solution to the problem while having a strong personal relationship. By following those recommendations and carefully looking into the achievement motivation theory, Catholic Healthcare will remain strong in providing high-quality standard of care while facing this pandemic. They could continue to expand their services across the globe and continue to have more employees wanting to join the organization who can be inspired by their company values that are governed by Christianity and solidarity. Their clients will be satisfied with the way they deliver their unique care as they continue to promote their values by showing respect, compassion, excellence, and honesty.